Okay, chapter 20, the last chapter of this textbook, is relatively straightforward. Nutrition during adulthood, uh, which you're all approaching, but we're mostly talking about the older generation, those 60 and over. There's really no real set time for when you're overweight, but this or over elderly or a senior adult, but generally over 65. And then the 85, as you can see here, year old plus is the fastest growing population. So one day, that'll be you, first your parents, and then you, and these are some of the nutrition concerns. One, as we age, certain things slow down. The nerve velocity conduction isn't that much of a reduction. Basal metabolic rate does slow down gradually from age, really it starts around age 30, but more substantially again, 65. You'll see a slowdown in your metabolism. So your ability to work slows, your cardiac output slows, lung capacity slows, and then your breathing capacity. So there's a lower need for calories slightly as you age. And the other things then is just looking at the nutrient needs. So just for this is really the most important section of this chapter, is looking at the protein needs, the calorie needs, carbs, and so forth. So one of the big changes in adulthood is that women after menopause need less iron because they're not losing monthly blood loss, so their iron needs aren't as high. And another big change is that as older folks move into long-term care facilities, there is a greater risk for malnutrition, and actually every senior adult is a greater risk for malnutrition as you age. It's harder to procure food. Older folks tend not to have a good enough income, not able to prepare, not able to eat as well. So the calorie needs decline, BMR declines, protein needs remain high. They still are at least 0.8, but really 1 gram per kilogram is recommended. There's more an increase in lactose intolerance, might be trouble chewing if dental problems occur. Too much protein is not a good idea. Needing carbohydrate with fiber is especially important to prevent constipation, preventing weight gain. And then the other difference is water, as we mentioned in one of our other chapters, is there's a less percent of water, so dehydration is more common of a problem. Possibly because of medications that are taken, possibly because of not wanting to drink too much because it's hard to get up, and there's some changes in some of the hormones in your kidney. Other nutrient changes then are the minerals and vitamins that you need change, so that there's a little bit more need for magnesium. Most adults don't get enough magnesium, and that helps with calcium absorption. Too much sodium can lead to high blood pressure. About 50% of Americans have high blood pressure. We mentioned iron already. Zinc loss could be because of not eating as much meat. Could be a problem, and if you don't have enough zinc, it also often leads to not being able to taste things, which then leads to not wanting to eat as much. And then the calcium, if we're not getting enough, can lead to osteoporosis. The vitamins of need are folate and B6. The lower intake, if we're not eating greens or not eating vegetables. B12 can be a problem because of absorption. As you age, your stomach acid is not as low, and B12 requires a low acidity to be absorbed. Vitamin E might be a lower intake. Carotenoids are especially important because of some of the eye problems that occur as we age. And then vitamin D, as we get into long-term care facilities, it's really hard to get outside. And so there's a higher incidence of osteoporosis because of that. So those are the changes that might occur. Other things are our body composition, as we already mentioned. We have lower lean body mass and more fat. So even if our weight doesn't change, the proportion of fat and lean body tissue does change as our muscles shrink and the cells atrophy, the muscle cells atrophy. And that's called sarcopenia. And also the collagen. The collagen that is the basic protein for all of our skin and organs really becomes less elastic and stiffens. So that's how you see wrinkles as we age, but it also affects our organs. And then another chart here talks about bone loss. So not just do we not get less vitamin D, we don't absorb it as well as we get old, we don't eat as much, we're not out in the sun as much. That leads to osteomalacia or rickets in children. osteoporosis, having so osteomalacia is soft bones, and osteoporosis is less bone mass and actually weaker bones. A lot of people that have osteoporosis cannot walk. They break bones very easily, and women are high risk for that. Osteoarthritis is another thing that can affect our joints because of overaction over the years that our joints wear out, and that's a disability. Digestive system, we've mentioned some things, decline in HDL in our stomachs, but also loss of teeth, making it hard to chew. And then even the pancreas functions decline, so our insulin isn't as well regulated. And the other systems, the nervous system, less taste, less hearing, less vision, that affects eating and balance. Our immune system can decline if we don't get the proper vitamins. And the endocrine system, again, because the hormones are all based on protein and other nutrients, are not going to be as effective as we age. So those, you just see that these aren't things that happen quickly. They gradually decline over time, but that does affect our nutrition. So older adults have nutrition-related concerns. Chronic diseases are more prevalent. So you might just have high blood pressure in your 50s, but in your 70s, you might now have had some small strokes, or maybe you have some high cholesterol also, and maybe your blood glucose levels are high, and maybe you're having trouble controlling your weight. So things become more chronic. You might have more diseases. Being underweight, we mentioned, is a problem, as well as being overweight. And then dental issues can affect what we do eat, how much of you need softer foods, we need cooked foods. It's hard to eat nuts and some of the things that help us. So those are some changes, and then just a couple more things. And this chapter also discusses alcohol. So the last section is talking about the effect of alcohol, not just on older people, but on anyone. So one of the first things here is that there's more calories. So if you're drinking ethanolic alcohol, is 7 calories instead of 4 calories, which is what there is for carbs and protein. And talking about binge drinker here. So there are a lot of Americans that suffer from what they can now call alcohol use disorder, or AUD. It's a general term for all the binge drinking, over drinking that can occur. So the thing to be aware of here is that alcohol is absorbed, but it absorbs very quickly. There's no digestion that really happens. There's just a couple enzymes that help break it down. If you drink more than your body can handle with the enzymes, it goes directly into your bloodstream, into all your organs, diffuses just like water. Wherever there's water, there's going to be alcohol in your body, so it can go in the cells, it can go blood, it can go into organs. The rate of absorption depends what it is you've had, and wine is faster absorbed than beer, for instance, and also how much, what your weight is, what your fluid levels are, your body fluid levels are. And so it is kind of a concern that some alcohol is considered healthy, but over abuse is obviously not. This is a problem with older people too, as well as young people. It starts out often when young. I have a friend who passed away at 39 from alcoholism, a college professor actually. So it affects everybody. Here is the thing to compare, like the alcohol level. So even though different alcoholic beverages have different percentages of alcohol, that these are about the same effect on you. So having a 12-ounce beer is about the same as having 1.5-ounce shot of liquor, or a 5-ounce fluid of wine. So you can compare. So the risks of heavy drinking then is because of its how it absorbs so quickly. The symptoms include trembling, slurred speech, sleep problems, and intoxication. As you drink more, you need less to become intoxicated. It can interact with medication. So the recommendation overall is no more than 1 drink per day. And 1 drink is defined as what we see here. Let's see. And then the other thing is, if you look at, there's a big problem. 17% of adult men, 17%, and 8% of adult women at some point have had a problem with alcohol use disorder. Some of that might be genetic. More of it might be just who your family friends are and what your habits are and how you handle stress. Another danger of excess amount of alcohol is the cirrhosis of the liver. So 20% of those with alcoholism actually have cirrhosis. And that is the fat infiltrates the liver, and the liver cells enlarge and actually burst, and it causes scar tissue. So when you don't have enough liver cells, you can't function as the warehouse where we handle all the vitamins, minerals, fat, calories. So without liver cells, then there's quite a lot of danger. 50% of those that have cirrhosis within 4 years of diagnosis die. There's no it does not reverse. Once you have scar tissue, there's no reversing of that damage. So that's a pretty serious side effect of alcohol. And here's a picture of a healthy liver and not so healthy liver. See how it's enlarged and there's all these globules of fat. And the last thing then is just being aware that if you have a drinking problem, there's a acronym CAGE they use that you can check yourself to see, like, have you felt like you maybe are drinking too much? Do people think you're drinking too much? Have you felt guilty about drinking too much? So if that's the case, there's several places to go online to double check, even one step further to see if you're over consuming or not. And it's definitely something to stop early because of the dangers of continuing too long. So the recommendation is up to 1 drink a women a day, 2 for men. But overall, to protect yourself, 1 drink a day is the safest. Of course, no drinking if you're pregnant or thinking about becoming pregnant. If you're taking certain medications, you shouldn't have drink because they're already taxing to your liver. And then monitoring your calorie intake because obviously it's pretty high, dense calories. So that is what this chapter is about. We covered nutrition for elderly, some of the changes that happen as your body ages, and then the effect of alcohol. And that is the end of chapter 20. Thank you.